Poultry diseases in Ethiopia causing high losses. Introduction. Hello, dear farmers, poultry producers, agricultural professionals, and everyone interested in poultry farming in Ethiopia. Welcome to today's detailed educational session. In this video, we are going to discuss one of the biggest challenges affecting poultry production in Ethiopia: poultry diseases that cause high economic losses. Poultry farming is very important in our country. It supports household income. It improves family nutrition. It creates employment opportunities, especially for women and youth. It contributes to food security through eggs and meat. But many poultry farmers are losing birds and money every year. Why? Because of diseases. Some diseases kill birds suddenly. Some reduce egg production slowly. Some weaken the immune system. Some reduce growth rate. Some increase feed costs. Many farmers focus only on feeding and housing. But disease prevention is equally important. Today we will discuss in detail Newcastle disease, infectious bursal disease, also known as gumboro, foulpox, coccidiosis, chronic respiratory disease, salmonellosis, and nutritional deficiencies. We will also discuss practical, realistic biosecurity measures that every poultry farmer in Ethiopia can apply. Please stay until the end, because prevention strategies will save you money. Let us begin. 1. Newcastle disease. Newcastle disease is one of the most serious poultry diseases in Ethiopia. It is caused by a highly contagious virus. This disease spreads very fast. It spreads through air. It spreads through contaminated water. It spreads through feed. It spreads through equipment. It spreads through people's shoes and clothes. It spreads through wild birds. If one bird becomes infected, the whole flock can become infected within a short time. Now let us talk about clinical signs. The first sign is sudden death. Farmers may find healthy-looking birds dead in the morning. Other signs include greenish diarrhea, depression, loss of appetite, twisted neck, also called torticollis, paralysis of wings or legs, difficulty breathing, sudden drop in egg production. Eggshells may become thin. Mortality can reach up to 80 or even 100% in unvaccinated flocks. Imagine losing 500 birds in 1 week. This is not just an animal health issue. It is an economic disaster. The financial loss includes loss of birds, loss of eggs, loss of feed investment, loss of market trust, loss of future income. Now let us talk about prevention. Newcastle disease can be prevented through vaccination. Vaccination must follow a schedule. Vaccines must be stored in cold conditions. Cold chain must be maintained from supplier to farm. Biosecurity must be strict. Sick birds must be isolated immediately. Dead birds must be disposed of properly. Vaccination is cheaper than replacing a flock. Remember this carefully. Prevention costs little. Outbreak costs everything. 2. Infectious bursal disease, gumboro. Now let us discuss infectious bursal disease, commonly known as gumboro. This disease mainly affects young chicks between 3 and 6 weeks of age. It attacks a very important organ called the bursa of Fabricius. This organ is responsible for developing the immune system. When gumboro damages the immune system, birds become weak against other diseases. Signs include depression, ruffled feathers, watery diarrhea, shaking, sudden death. Even birds that survive may never grow properly. They may respond poorly to vaccination. They may become more susceptible to Newcastle disease, CRD, and other infections. Economic losses include high chick mortality, poor growth rate, increased medication costs, poor feed conversion, weak immune response. Prevention includes timely vaccination, proper brooding management, avoid mixing age groups, maintain strict hygiene. Do not underestimate gumboro. It silently destroys the immune system. 3. Foulpox. Foulpox is common especially in backyard poultry systems. It spreads mainly through mosquitoes and direct contact. There are 2 forms of foulpox, the dry form and the wet form. The dry form shows wart-like lesions on the comb, wattles, and eyelids. The wet form affects the mouth and throat. Birds may have difficulty eating. They may have difficulty breathing. They may lose weight. Egg production decreases. Although mortality is usually lower than Newcastle disease, economic loss still occurs. Growth becomes slow. Birds look unattractive in the market. Egg production declines. Prevention includes vaccination and mosquito control. Remove standing water around poultry houses. Vaccinate at the recommended age. Separate infected birds. 4. Coccidiosis. Coccidiosis is caused by microscopic parasites that damage the intestine. It is very common in farms with poor litter management. Wet litter is the biggest risk factor. Overcrowding increases risk. Poor ventilation increases risk. Signs include bloody diarrhea, weakness, pale comb, weight loss, poor growth, sudden death in severe cases. Birds may eat feed but fail to gain weight. Feed cost increases, profit decreases. Prevention includes keeping litter dry, avoid overcrowding, use anticoccidial drugs properly, follow veterinary guidance. Clean environment reduces parasite multiplication. 5. Chronic respiratory disease. Chronic respiratory disease, or CRD, is caused by mycoplasma. It spreads through air and infected parent stock. Signs include coughing, sneezing, nasal discharge, swollen sinuses, reduced egg production, slow growth. Mortality may not be very high, but production loss is significant. Feed conversion becomes poor. Egg numbers drop. Control includes proper ventilation, avoid overcrowding, buy chicks from reputable hatcheries, consult veterinarians for treatment. 6. Salmonellosis. Salmonellosis is dangerous because it affects both poultry and humans. It spreads through contaminated feed, water, rodents, and dirty hatcheries. Signs include diarrhea, weakness, poor hatchability, high chick mortality. Humans may get infected from raw or undercooked eggs and meat. Prevention includes clean feed storage, rodent control, egg sanitation, proper cooking. Public health and poultry health are connected. 7. Nutritional deficiencies. Not all losses are caused by infection. Poor nutrition causes serious economic problems.